I have just chaired a meeting of the Scottish Government's Resilience Room, which met to discuss the rising number of new COVID cases across Scotland, but particularly the rising number of cases in recent days in Glasgow and the west of Scotland. Over the past 2 days, we've seen 314 new cases in Scotland, and 135 of these have been in the Greater Glasgow and Clyde area. If these numbers continue, and this is the fear, if they rise further, then more people will fall ill from COVID and more people may enter hospital and intensive care. We'll also see growing pressure on our test and protect teams who trace contacts for each person with COVID and who are absolutely vital in our battle to keep it under control. And we could, if we don't stem this tide, see the virus run out of control again. So today's meeting discussed the actions we can take quickly and hopefully preventatively to stop that happening. We are particularly concerned right now that the level of COVID is high in 3 local authority areas within the Greater Glasgow and Clyde Health Board area. West Dunbartonshire's daily incident rate of COVID is nearly 33 per 100,000 people. The City of Glasgow's is nearly 22. And East Renfrewshire's is almost 19. For comparison, the rate across Scotland has been rising in recent days, but in the past few days has been just a bit over 10. We can also see, and this is in contrast to the situation in Aberdeen a few weeks ago, that transmission appears mainly to be happening inside people's homes and between households rather than in pubs and restaurants. Having carefully considered the data and consulted with local public health officials, local authorities and Police Scotland, all of whom were involved in the resilience meeting discussion that has just taken place, I can therefore confirm this evening that we have decided to take the following action. From midnight tonight, if you live in local authority areas of East Renfrewshire, the City of Glasgow, or West Dunbartonshire, you should not host people from other households in your home, and you should not visit someone else's home, no matter where that is. The only exception to that, apart from obviously in emergencies or to provide care for a vulnerable person, relates to the extended households that were established during lockdown, when people who lived alone, couples who do not live together, or parents who live alone with children under 18 could join with one other household to provide mutual support. Secondly, if any member of your household grouping is identified as a close contact of a confirmed positive case of COVID, then we are now asking the whole household to self-isolate for 14 days. Again, that applies in these 3 local authority areas of West Dunbartonshire, the City of Glasgow and East Renfrewshire. And thirdly, visiting care homes in these 3 local authority areas will also be restricted to outdoor visits only, and hospital visiting will return to essential visitors only. In addition, those who were previously advised to shield will receive advice to be extra vigilant at this time. There will be more detail of all of this available on the Scottish Government website and social media feeds later on. It is our expectation that these measures that I have just outlined will be in place for a 2-week period. However, we will review them after 1 week. I want to stress and assure everybody in these 3 local authority areas that these are decisions that have not been taken lightly. They form guidance at the moment, but we will also consider, if necessary, putting them into regulation and giving them the force of law. I also cannot rule out that if we don't see these measures working and being effective, that we may have to go further. However, and I want to stress this point, it is hoped that by acting quickly in this preventative way, we can avoid having to take further action or imposing any further restrictions later on. I know that the vast majority of people have been sticking to rules and guidelines, and I know how difficult lockdown has been, and this situation continues to be for everyone. But COVID continues to be a dangerous and sometimes deadly virus. It is spreading again, particularly in these 3 local authority areas, and we believe that in these areas it is spreading primarily as a result of household gatherings. So in these circumstances, stopping household gatherings for a period and strengthening self-isolation for people who may have been in contact with the virus is the most proportionate action we can take to reduce transmission. Taking this step supports our schools to stay open and also limits the impact on jobs and the economy. Now, I know how unwelcome this news this evening will be for people who live in these areas. I know that because I am one of you. I live in Glasgow, so these rules apply to me as they do to everybody else in these areas. I won't be able to have my family visit me at home, and nor will I be able to travel to a different local authority, in my case Ayrshire, to visit them. While I know this will be hard, it is essential. The burden of today's restrictions is obviously being borne by people in these three particular areas. Just to remind everybody, that is West Dunbartonshire, the City of Glasgow and East Renfrewshire. But there is a wider message here about indoor meetings that needs to be heard right across the country right now. The threat of COVID hasn't gone away, and we must all stick to the rules and to the guidelines. That applies particularly indoors. So please, in other parts of the country, stick to the limits for indoor gatherings. You should not be meeting indoors with more than 8 people from a maximum of 3 households. And these rules apply in pubs and restaurants as well. We must act collectively to keep this virus under control. So I will end with a reminder of the facts guidance that encapsulates all of the advice we're asking everybody to follow. Wear face coverings in enclosed spaces, avoid crowded places indoors or outdoors, clean your hands and hard surfaces regularly, keep a 2-metre distance from people in other households, and self-isolate and book a test if you have symptoms. If all of us abide by this, then we can give ourselves that chance of keeping the virus under control, avoid more restrictions in these 3 areas that I've spoken about this evening, and hopefully avoid these kinds of restrictions being applied anywhere else. Now, finally, there will be more detail available on the Scottish Government's website later for people living in these 3 local authority areas. For those who may be asked over this period to self-isolate, the councils will be putting in place arrangements for welfare support and advice as well. But for now, thank you very much for listening, and for those of you who continue to stick to these rules, thank you for what you're doing to help us keep this virus